Hey guys, and welcome back to another quick off the cuff. Today I am hoping that we can behave like adults used to do back in the good old days before everything would divide people, polarize people. Because today we're going to be talking about something to do with the jab and the disease. The disease related to the virus of the pandemic that we are currently enduring. Because I thought it was quite interesting information. So Dr. John Campbell so for the last year his YouTube channel has really exploded. I think he has 2.5 million subscribers, medical background, members of various boards, and the reason that a lot of people kind of flocked to him was because he has not been swayed by sort of the media or corporations. Excuse me. And I thought it was interesting because, and also the reason that I trust him, the reason that I thought I'd talk about this today was because me and Exelanzic were talking about big pharma and the problem with the fact that their money is influencing culture, influencing media, influencing politics, and that is incredibly dangerous when we're talking about things that can potentially harm people. In those circumstances we were talking about, in regards to the trans thing, obviously they're making an awful lot of money off that. But it also goes with the opiate problem, and as well to a degree with the jab. Now I know that this topic can sort of polarize people massively. This is not what I want to happen. I'm really, really hoping that we can just go back to being able to talk about things like Dr. John Campbell does in a sort of calm and rational way. Because we're never going to get anywhere if we just immediately put our backs to the wall and take sides. We've got to be able to use our brains and look things up and sort of weigh everything up. And so I hope that that's what we can do today. So the topic that he was talking about was myocarditis. So myocarditis, I am not medical, so do not take your advice from me. Speak to your doctor. Get as much information as you can, and then you can come and you can make your decision from there. But essentially, it's an issue with the heart, and it's mostly, from what we can see, affecting young men. The people most affected are middle teenage boys. And the people least affected are sort of, I guess both sexes after 50. Now, a lot of the statistics are very varied with this whole thing. So, for example, we know, at least in the UK, the very common statistic of your chances of perishing from the disease are 0.037. But that 0.037%. But that is obviously over the entire age, gender, the whole spectrum. So, for example, if you're in your 20s, it's going to be significantly lower than 0.037. And I know for a fact that if you are over 90, it goes up to 16%. Pretty chunky percent. Chunky number. And then if you're under 4, it's 0%. Those are the statistics they have given. Whether it's such a low decimal in that's why they just put 0, I don't know. But yeah, so I just thought it was really interesting. So we've obviously heard from the guy that invented the mRNA delivery system about the issues that they had at the beginning of it, of passing the tests, because they were having issues with men and myocarditis, and women having issues down there, so affecting their periods, ovaries, all those things that I'm not a specialist in. So let's have a listen.
Well, welcome to today's talk. Now, I'm going to give you the essence of this talk in about the first 4 or 5 minutes, and then if you want to watch the whole thing, you can. Now, it's based on this question here. This is from Sarah. John, please could you review this article from Israel's national news? It says the risk of myocarditis following mRNA COVID vaccine is around 133 times greater than the background risk. Is this true? And if it is true, why is it not all over mainstream media? Well, to deal with that last bit first, I don't know why mainstream media don't seem to report on these things more than they do. You would think it would be a legitimate part of informed comment. So I don't know the answer to that one. You'd have to ask the Director General of the various mainstream media outlets and their people in charge. But let's just clarify the question here. This is it here, new study, and it does say 133 times risk of myocarditis after COVID vaccination. And to answer this question, of course, because we have to just go by exactly what the evidence says, we have to go to the actual study here where this originated from. So this is the study that's actually originated from, and it's in JAMA, Journal of the American Medical Association. You can download the PDF. It's all available free, which of course is very generous, and the whole thing is there. Now, to be fair, it's not a very easy read, so I'm just going to give you sort of a quick pre-say of this, a summary of it, and you can decide whether you want to listen to the rest or not. Is there 133 times greater risk? It's actually probably much more significant than that, but what we know from the data, my calculations at least, it's 84 times increased risk in the higher risk category of young men and adolescents. Now, why am I saying it's actually 84 times the risk based on the data, but why am I saying it's probably more than 133 times the risk? In other words, that this is an underestimate of risk. Well, there's fairly strict criteria for diagnosing a case of myocarditis, and indeed pericarditis, so fairly strict criteria. So it's conceivable that some people have an inflamed myocardium, and therefore by definition myocarditis might not meet the criteria. That could be true of some cases. Many cases, of course, are simply not reported. People simply don't report the case. How many, we have no idea. Now, this is all based on VIRAS data, the Vaccine Adverse Events Reporting System in the United States. And I've looked at this, and although it says that anyone can fill out a VIRAS return, really you've got to be quite a specialist clinician to do it. I mean, I had to think about it, and I'll show you why it's complicated before. So we can conclude that there's an increased risk of myocarditis and pericarditis after the mRNA vaccines. We can say that definitely. Can we say that it's caused by the vaccine? Technically, the paper doesn't claim that. It says there's an increased risk after the vaccine. So you'll have to decide yourself whether it's a causal link or not. The paper doesn't claim it's a causal link. It just says there's an increased risk, which is patently the case. So if you want to carry on watching, do. It is pretty interesting paper. Now, myocarditis cases reported after this. That's the name of the paper there. US data from the 20th of December to August 2021. So there's a good few months of data there. That's good. Paper published just on the 25th of January. Now, I've just put this list of people in here so you can see where these people are working. This is a very prestigious source. So a lot of people work for the CDC, School of Medicine and Moore University, Children's Healthcare of Atlanta, etc. Pretty prestigious institutions, and a long list of authors. So this paper carries quite a lot of credibility. This is the actual reference that JAMA like you to cite, so I've done so. That's their actual reference. Now, this is important because vaccinations against COVID-19 provide clear public health benefits according to the paper, but vaccination also carries potential risks. So I think both fairly obviously true statements there to kick off. The risk and outcomes of myocarditis after COVID-19 vaccination are unclear, according to this paper. So they're actually saying that it's still unclear. That's why this needs clarified, which of course is what they're attempting to carry out with this paper. Where am I? There we are. To describe reports of myocarditis and the reporting rates after mRNA-based COVID-19 vaccines in the United States. So that's what this is about. Now, it's a descriptive study. Reports from myocarditis to the Vaccine Adverse Events Reporting System, VIRAS. So it depends on this reporting, and it's a passive system. So if this complication comes up, or any complication comes up from the vaccine, people can decide to fill out this VIRAS form or not. But as I'll show you, it's a really quite a complicated form. And I know very often when drug complications are come across in the UK, it's actually quite a big job to report it. So sometimes it's just simply not done. So really, these VIRAS returns are the minimum amount, and the real number could be much high, but of course I can't say that definitively. We don't know. We don't know how often these forms aren't filled out. We know how often they are filled out. After mRNA-based vaccine, so that's what this is about. Now, let's before we look at some interesting graphics, let's look at this. So it's between those dates, 20 December, 21st of August, in 192 million people older than the age of 12. But of course, we notice that of this 192 million, which is the whole number of people probably been vaccinated in this time period, many of these are much older than the age range in which myocarditis is likely to occur. So that figure, you could argue, is well, it is correct, but it's also remember, it's the younger demographic that's at risk of this. It's virtually unheard of at my age. This is typically people under 30 that are affected by this. So here we have some of the data here. So this is a vaccination with BNT162b2, which is of course the Pfizer vaccine. So up and down here we've got reported cases of myocarditis after vaccination with Pfizer. Age at onset of myocarditis. So these are years. So for example, the highest rate here is people that are 16 years of age. And that was the number of cases with the Pfizer vaccine. Until we get to 40 years of age, when 39, 40, when there's actually very few cases, and they don't even bother putting the 50s and 60s and 70s and 80s because it is so uncommon, or virtually unheard of in those older age groups. So this is so important because we're dealing with young people here, and this is the number. This is the number for all young people.
So yeah, there you go. I hope. I'm not trying to push anybody in any direction. As I say, you should always speak to your doctor. The one thing I will say is I do have friends involved in medicine, and many doctors are, because they're not specialists in this field, they will just go by, the sort of feeling in the air, the zeitgeist. They won't have always done their due diligence. But again, that's all you can really go by, certainly not by me. But I do think, part of the reason I brought this up is just because I am certainly not against any particular medicine or any particular vaccination or whatever. But I do think it's really important people don't just get swept up in this weird sort of cultural civil war that we seem to be having, because it's very important that we don't just look at broad numbers. And I know that you could say, well, that's a bit hypocritical, you've just been talking about facts and figures. What I mean by that is you need to know, like if you're making a very big decision, like whether or not you're going to get your 14-year-old jabbed, it doesn't mean anything to you how many 85-year-olds have just perished in your village or in your city. What you need to know is what are the chances that something is going to happen to a teenage boy? What are the chances that, and not just death, like that's something that we also have to consider, long COVID and these sort of things that we've been hearing about. I think the figure overall, again, this is not age specific, is around 1.2 to 1.8%. But again, like when you go down to younger people, it's extremely low 0.0s still for long COVID. So yeah, I think it's really important that people start standing up and not just going along with what people have been paid to tell them, because that's something that's very important. And we often see it when people get laid off from news stations or politicians that end up leaving their party, is that it's only then that they actually say, oh, by the way, yeah, this was not true, I was just saying it because we were getting lobbying money. And again, I just think it's very important, after everything that we talked about with Exelanzic, that people think that through, because these things are very, very important decisions, and I think we should not be letting social media guide us to the decision that we make. But yeah, thanks a lot for listening, guys, and I will see you again soon.